I have 3 separate shavers here today to show the differences. This up top is our standard arthroscopic shaver, and then on the bottom you have a standard Dex Blade. The Nanosaber here in the center is 2.8 millimeters by 11 centimeters. It's 30% smaller in diameter than the standard blade that you see above. It's 40% longer than this Dex Blade that you see below. And let's talk about that. That's really important because the length, the added length of the Nanosaber allows it to get into the posterior compartment of the knee for those mastectomies or any time that you really need that added length. In addition to that, it can reach those hard to reach areas in the shoulder joint. So it makes the Nanosaber very, very useful. It works with this lightweight ergonomic handpiece, and it has a fantastic weight balance when you're using the nanoscope in the opposite arm. Its smooth blade leaves smooth anatomic bites. It does precise resection. It works great with the nanobiter and mastectomies, and I've found it very helpful to combine this, the Nanosaber, onto a shaver with the GraftNet to harvest cartilage, bone, or synovium, or other tissues that you may want to harvest during your case. Okay, so we're going to demonstrate the Nanosaber, and first we obviously have to percutaneously make a portal here on the medial aspect of the knee to get the Nanosaber in. So we're going to come in with a spinal needle, and here you can see we're in with a spinal needle. We're going to take the center cannulation out of the spinal needle. We're going to place a nitinol wire into the knee joint, and this helps dilate this up so that we can actually place it percutaneously. So to dilate this portal here, I like to take a standard nanoscopic cannula. So now we have a nanoscopic cannula in the knee on both joint spaces. And so I can take the nanoscope, I can switch it to the medial side, I can switch it back to the lateral side at this point. But what we're going to do in this case is we have a lateral meniscus tear over here that we're going to use the Nanosaber on. And so I'm going to remove this medial cannulation there. You can see that medial cannula is removed. I'm going to go right in that skin cannulation that's been made, and now I'm into the joint with my Nanosaber. Okay, so you can immediately see the difference in length of the Nanosaber versus the Dex Blade. So for example, I'm all the way on the medial side of the knee and I'm getting all the way laterally because of that added length. So you can see this frayed meniscus. It's the lateral meniscus, and what we're going to do, we're going to do a standard partial lateral mastectomy, and you can see how aggressive this is through these percutaneous holes and incisions basically. And again, we're getting all the way on the other side of the knee from a medial portal very easily. Very aggressive, and you can see that it's not chopping up the meniscus. It's doing a very nice job at being anatomic on its resection while still being aggressive. So I love that. We're going to come forward here. You can see the percutaneous portals that we're working through. We can get all the way back to the posterior lateral corner of the knee from a standard knee medial portal placement. And that's a game changer when we're talking about nano instrumentation. We're going to work on the posterior horn slightly. You could also come in here with a nanobiter, obviously, to finish up the partial lateral mastectomy. But this is doing an excellent job at giving nice smooth edges to work with. One thing I'd like to point out is how fast this partial lateral mastectomy has been compared to my experience with other shavers of its like and size. And this is dramatically reducing the amount of time to do a standard partial lateral mastectomy with a shaver. You can see right there in the back posterior lateral aspect of the knee, there's a small little area of meniscus. We're going to come in from medially, and we're going to bite that area out with this small nanobiter. So now that I've loosened that meniscus up, I'm going to come back in with my Nanosaber, and we're going to finish our partial lateral mastectomy back there. Alright, so you can see the partial lateral mastectomy, less than 5 minutes because of the aggressiveness and the length of this shaver. I think the Nanosaber is going to change the game when it comes to nanoscopic surgery, especially in the knee and shoulder joints. So we're back on the medial side of the knee now. You can see a small meniscus tear back here. And one of the advantages, this is a tight knee, obviously an arthritic knee. One of the great advantages of the nanoscope is it can slide into a tight compartment, and we're percutaneously working through this medial compartment. We're going to percutaneously place our Nanosaber device. And again, we're going to do a partial mastectomy here with the Nanosaber. And so I think what you're going to find, if you've worked with other shavers of a similar size, you know, in the marketplace, that this shaver is 2.8 millimeters, and it's really aggressive. It does a nice, fast partial mastectomy, and it has the length, as you can see, to get all the way into the back of the knee. And that are the defining characteristics to me that I think are going to change the game in nanoarthroscopy in the future. With this device, because we're using it percutaneously through a portal, in this case, that we created with one of the nanoscopic cannulas. And so you can take a look at the knee, and I'll just slide out here. As you can see, we've done the partial medial mastectomy. And so we'll focus in on the knee joint here as we remove the nanoscope at the medial and lateral sides. And you can see just percutaneous portals. You can just use a band-aid. You may want to use a small suture to close, but nothing more than a single suture. This patient, in 2 to 3 days, will be feeling like they barely had surgery. I've had patients that have went back to their jobs within a day, standing all day long. Okay, so one of the techniques we published recently is a nanoscopic autocart procedure. And what that is where we take and utilize the GraftNet to a shaver, and we harvest the non-articulating area of the trochlea. As you can see here, we're on the medial side. So we're going to run it on oscillate, and we're getting cartilage, viable cartilage cells to come into our GraftNet. We'll use this, and we'll use these cells to mix with biocartilage and then perform an autocart procedure to possibly a medial or lateral femoral condyle lesion. And what's interesting is, in this case, we're using the Nanosaber. And regardless of which shaver that you would use, the cells have been found to maintain their cell viability as far as the chondrocytes. And so that's important information for us to have, because we don't have to use a large 4.0 shaver. As you can see here, we're using a smaller 2.8 shaver, the Nanosaber, and we're achieving the same result, and we're doing it percutaneously. Which dramatically can change, you know, autograft cartilage transfer. Now I'm on the lateral side of the trochlea. I'm harvesting still with the GraftNet the autograft cartilage cells, and you can pay attention to. I would say this is more like a dental procedure. You know, I can hold the Nanosaber like a pen, and that dramatically affects your preciseness in the joint. And also, over a long day of operating is going to, you know, fatigue you less. And I think it balances so greatly, as you can see with my other hand, which has the nanoscope.